Alrighty, so you would knock on the patient door, come in, introduce yourself, explain that we'd be doing a physical exam of the neck, thyroid, and lymph nodes. Make sure you use hand sanitizer before touching the patient, and just make sure you get consent that you're allowed to go through with it. So we'll go ahead and we'll start and we'll inspect the anterior sides of the neck. We'll go ahead and inspect the lateral sides of the neck. And we'll go ahead and we'll inspect the posterior side of the neck. Alrighty. No bruising, edema, or scarring appears to be present. By looking at the neck, there's no webbing, no masses appear present, and no abnormal shortness. Then we'll go ahead and we'll we'll palpate for the musculature of the neck. So we'll start right here. Let me know if I'm causing any discomfort. Alright, and then we'll come behind, and we're going to feel for the vertebrae and bony prominences. I'll have you look down for me just a little bit. Alrighty, no abnormalities with the bony prominences, no odd enlargements or masses present or palatable. And then we'll go ahead and we'll test the full range of motion. I'll have you go ahead and just look up for me at the ceiling, look down at the floor, go ahead and look left for me, go ahead and look right. I think that's it. And then we'll have you put your left ear to your left shoulder, right ear to your right shoulder. Patient has full range of motion of the neck. You can go ahead and look upright again. I'll have you go ahead and shrug your shoulders. All right, I'm gonna push down while you shrug them. Don't let me. Yep, don't let me push down. There we go. Accessory nerve or cranial nerve 11 is intact. And then we'll go ahead and we'll test strength against resistance. So I'm gonna go ahead and I'm just gonna push against your head and I'm just gonna have you resist against me. Front of your head, alrighty. We'll do the back of your head, resist. We'll go on this side, resist against me pushing. We'll go on this side. Alrighty, patient has a 5 out of 5 strength against resistance. Because everything with that, and then we'll go ahead and we'll move to the palpating the lymph nodes. So apply hand sanitizer after feeling for that. And we'll go ahead, go back here. I'm gonna feel for your occipital lymph node. And this would be at the base of the skull. I know it might be hard to see. Then we'll go in the back right behind the ear and you'll do the post-auricular. Try to do it in a circular motion or just soft motion. Then we'll go right up here in front of the ears and we'll do the pre-auricular. Alrighty, we'll come down here, we'll do the parotid. And then we'll go back here and we'll do the tonsillar. Let me know if I'm causing any discomfort. We'll do this right at that bend. And then we'll do submandibular. And then I'll have you go ahead and just look a little bit down for me. We'll go under here, feel for the subomental. Alrighty, was there any tenderness with that?
Nope.
No tenderness or swelling noted. We'll go and then we'll test the suprascapular. So I'm just gonna kind of pull this off to the side. I'll have you look down for me at the ceiling or at the floor. We'll feel right inside the clavicle. Sorry if that's causing any discomfort. I know it's uncomfortable. Feel deep inside there. And then we'll go to infrascapular, right up front. Was there any tenderness with that?
Nope.
No tenderness or swelling noted. Then I'll have you go ahead and look left for me. We'll look at the anterior and posterior cervical chain. So you want to look, we'll go right here, right in front of the muscle. Up there. It's the anterior. And then we'll go back here and do more of the anterior. Posterior. Alrighty, and we would do that bilaterally. Was there any tenderness?
Nope.
No tenderness or swelling noted. Then we'll go ahead and assess the trachea. Alright, I'll come down here. Alright, trachea appears mobile and appears midline. No abnormalities noted. I will then come around and we'll test for the thyroid gland. And then we'll make sure you want to feel at the base of their neck. Alrighty, no enlargements or masses palpable. Alrighty, and then I'll have you go ahead and swallow for me. Alrighty, slight raising of the thyroid gland with swallowing. Was there any tenderness or pain with that?
No.
No abnormalities noted.